everybody. Dr. Joe Bafile here. Another episode of Abundant Health Naturally, Part 2, Pain Management. And last time we talked about, this is going to be a part 2 because we had, some question and answers. So we put it out there for some people and we got a few questions. So we're graced by the presence again of Dr. Phyllis Russo, Dr-LiveWell. Hey, Phyllis, what's happening?
What's happening in your world? Do you know, I'm not going to tell you what's happening, but my head kind of goes squirrel. We've been talking for a while before we started this, and I just realized you're in a different room.
I was wondering when you were going to ask that. This particular background that you see is my nutritional counseling room, or where I do nutritional therapy in our office at Bafile Family Chiropractic. So you can see the test vials, my charts, where I do a lot of the muscle testing.
Look
So
at that. I like that room. Isn't that funny? Honestly, everybody, we've been talking just about life and about the news. And this whole time, I'm sitting here smiling, just waiting for you to introduce me. And I realize we have not been in this room yet. So there we go.
we want to begin about pain, pain management yet again. And I just wanted to bring up something real quick. Bear with me because I lost it. I don't know how I got rid of it. There we go. I want to recap for folks about what the definition of pain, because it's been a few weeks since we've done this. Pain is a signal in your nervous system that says something is wrong.
Ah!
Exactly. It is an unpleasant feeling, such as a prick, a tingle, a sting, a burn, or an ache. Each person feels pain differently, even if the reason for the pain is the same. So again, there's another reason why we can't judge everybody and their expression of pain, because everybody has a different load to carry. Pain may be sharp, dull, it may be mild or severe, and everybody's, expression of that pain. Hey, Mr. Jones, is your pain 0 to 10 on the scale? Well, Mr. Jones, maybe, his 10 may be someone else's 1. Pain may come and go, or it may be constant. You may feel like pain in one area of your body, such as your back, your abdomen, your chest, or even your pelvis, and you may feel it all over. So pain is, it's a real pain.
Well, there's a lot of facets to it.
There is.
I
And
always do that 1 to 10 scale though, because here's the thing. Well, it's kind of funny. There will be some patients that they'll go when they're coming in for sort of this massive situation, and I go, okay, what is it on a 1 to 10? Thinking, is it a 7? Is it an 8 or a 9? And the person says, oh, it's a 2. And then I'm like, okay, I don't know if I can fully get that one because he or she is in for a particular reason. Otherwise, this type of person would never even come to the doctor, the chiropractor, anything like that. So, but I do use it 9900% of the time because it really does lead us to how we prescribe, what we perform, what type of modalities we use. So it is an important one. I also I always make sure that I ask how often it happens. Are you doing this throughout the day? Is it a 18 hours of the day? Can you
right.
sleep with it? Oh no, it's just when I stand up. It's just when I sit down. It's just when I twirl around. So you always want to look at that when it happens, what they do, what relieves it at home, even and positionally. So if it's a joint pain, if it's a knee pain, does it feel better I remember I used to have knee pain myself, and every time I would go to my own chiropractor when I was back in the Dallas area, and it would always change. And then the question would be like, is there some position that's better? Sometimes lying down and keeping my legs straight actually was worse than walking. So you just never know. And as physicians, we both ask these questions very particularly. I think it's real important to be very particular to each patient because that will help. You're about to ask some questions. That will help in kind of which way we help, we prescribe, we suggest. We don't really prescribe drugs, but we do prescribe herbs, nutrients, things like that. So,
And thank you for that. It really, most people don't understand that protocol or why we ask the questions that we ask. I mean, it helps us identify, or kind of like us being a detective to, who done it type situation, so that we can come up with that plan of action to help better serve that person and help their body heal better rather than just feeling better. Because without asking the right questions, because 95% of the people that come into our offices are in pain, whether it's neck pain, headaches, low back
right.
pain. And, it'd be great if 95% of them were coming in because they want to be well.
What is your percentage of, this just made me think of it when you said that. What is your percentage of patients that come in like on a monthly or a bi-monthly basis, or every other month? I'm not sure if that's bi-monthly, but that come in just to stay well.
I have within our care plans, once they reach a point, we try to keep them on a plan of once every 3 weeks, once every 4, 6. I have a handful of people that come in every 8 weeks. We find out what is most right for their situation. So I don't have a specific number, but we have quite a bit. I mean, if it wasn't for those people that are continuing care, we would be specifically a pain management type office, and they would drop off as soon as they're done. So we are blessed to have a good amount of people that stick with it because of our educational process and how we connect with them on a visit by visit basis. That's why Dr. Courtney, my associate doctor, and our team and I, we have some downtimes, but we have also our busy times where we're very popular. So
I love that about the practice. I remember I used to say, you have teeth. How often do you go see your dentist to get them
yeah,
cleaned? And I go 3 times a year. I know a lot of people go twice a year, but it's the same thing. You have a spine, you have a back, you have a head, you have a body, you have joints. You really want to keep them well.
but our general public does not think of their bodies this way. And you're right. The dental analogy is very true. And I've said it many times to people that if you stop brushing your teeth, not just going to the dentist for a uh, technical deep cleaning, but if you ignore brushing your teeth, what's going to happen? They're going to rot and decay. Do you want that to happen? I mean, that's just gross. So, and when I
Sorry, that was funny.
when I bring that up to people, they're like, "Ew, yeah." All right. So think about this. Getting your spine adjusted on a regular basis because our postures suck because we're on our phones, we're sleeping in awkward positions. I mean, falling asleep on the couch or a recliner is not supporting your spine in the most right way. Your spine's going to decay much faster.
Yeah. Think
So,
about it even on a nutritional way too.
right,
Like,
exactly.
so just like you said, I love it because I always do the analogy with going in and getting, getting the teeth cleaning. But I love that. Like, what if you didn't brush, right? Your teeth. And then if you analogize, oh, forget it. If you make that an analogy, we'll do it that way. Um, I mean, think about why it's so important to eat good foods, to eat natural foods, to eat regenerative meats, all of these things that supply your gut to have a good microbiome and feeds your brain. Hello. So I love that. I got to start using that analogy.
And
Now,
that is where I feel that I have been
analogous.
blessed to connect with people and not necessarily read them, but understand where they're coming from so that I don't always have to utilize the dental analogy. I can meet them where they're at in the
Yeah.
places that they function in on a daily basis, their careers, their lifestyles, and say, hey, think of it this way. When I'm asking you these questions, and I feel like a politician with my hand like this, but when I'm asking you these questions, 95% of the people come into our office because of pain.
Mhm.
But the questions that we ask you, that history of your pain gives us 95% of your diagnosis and where we need to go.
Yeah, that is the importance of listening to the patient.
Yes. Where unfortunately, a lot of healthcare providers today aren't doing that. And we've discussed this before on this podcast that, listen, if we take those words or the letters of listen and we rearrange it, it says silent. So we need to sometimes zip our lips
How do
and
you come up with these things?
say,
Listen
this,
and silent.
yeah, I challenge you to write it down and
You
rearrange the
are
letters.
a magical man.
It's called rip off and duplicate. Rad.
I like that.
So everybody, put your seatbelts on. The pilot's about ready to pull the
Take
lever
off.
back, and we're going to accelerate here. But we got three questions we want to work on, and we're going to really touch on these. And then in the end, we're going to give you some ideas of how do we combat the pain on a natural, alternative, holistic approach. Some things that we've already talked about in part one, but here we're just going to kind of revisit them a bit. So hang with us. This is not a transatlantic flight, but we are going to get to our destination. So, number one question in dealing with pain management, and this is a specific one that's, we actually have a month in the year that we, I don't want to say celebrate, but make it awareness of headaches. Did you know that June is Headache Awareness Month? I know here we are in September, but the question was, what do you do if you have a headache? So we're dealing with pain. We have a headache. What do we do?
Well, a lot of people do things like NSAIDs or aspirins or things like that, but they have so many side effects. So my number one, well, do you want to start with
So let me
chiropractic?
give you, let me take a little side note because this is something near and dear to my heart. This is probably one of the reasons why I became a doctor of chiropractic. I
That you're,
suffered,
wait
I
a minute.
suffered with headaches.
Wait, I'm sorry. Oh, darn. I thought you were going to say you are a headache.
Wow. I could be that way to my wife and
Yeah, I
sometimes
knew
to
you were
my
going to
team.
mention Jill.
Yeah. But my story is when I was 5 years old, I suffered with headaches quite a bit. Maybe I fell off the porch too many times, maybe too many jumps with my bicycle. But my mom had the wisdom of taking me to a chiropractor when I was 5. That was when I had my first chiropractic adjustment. And from that point, I believe that sowed a seed. We've talked about sowing seeds and reaping a harvest. Here I am today. And it's interesting because there's a lot of folks that I have attracted that deal with headaches. And I get to be empathetic and understand what they're going through. And I remember even in chiropractic school dealing with headaches so, how do I say, so bad or enormously debilitating, where even you, Phyllis, you would adjust me in that
Mhm.
time when I was in clinic or when I worked in your office. Um, And I think a lot of it was toxic issues with how I was being fed during that time uh, when I was younger, because of just socioeconomically status, the being raised by a single parent. There's so many different things that we could say about that. But chiropractic, the adjustments worked wonders and removed that interference to allow the pain to be calmed down and allow my body that environment to heal. Now, do I still get headaches today? From time to time, nowhere near what I used to. And if I go beyond 2 weeks without getting an adjustment, I get adjusted weekly. That is my health care. And when I sit down with a patient during a care plan discussion or report of findings, I say, listen, we're going to start off so many visits here up close together to restore your body's functioning, relief, stabilization, working on corrective care. But then we want to get you to a wellness plan where you're getting adjusted on a regular basis to help keep you well. And to me, that's very important. And that's how headaches have affected my life and what I do for headaches.
I mean, I remember when patients would come in, headaches actually were fairly easy to handle. Like there's almost, well, we can talk about migraines, which is a little bit different, but the headaches in general, so much of it is from cervical spine and from our posture and from where our, the positional. And then, of course, it's from stress.
Yes.
So everyday stress, those type A personalities, people that are moving and grooving and can't stop. And so adjustments are great for that. Absolutely wonderful. Now, I will tell you, I don't get adjusted nearly as often as you, but I will tell you, it's the one thing. I know I have had a lot of stuff. I've had Hashimoto's and kind of what comes from that. There are times where maybe, and you might be jealous of me, maybe I get a headache once a year. But give me that. Would you please just give me that? I got enough.
Hey, listen, if you never experienced it, how can you relate to those that do?
Well, I have.
Right.
See, and just so you know, I have experienced a headache. And all I keep saying, it's funny, throughout the last 40 years, 35 years of my life, I would say when I get a headache, oh my God, how did so and so put up with this? Like I see somebody coming in fairly often and I'm going, how do they live with this? So I've experienced it enough to have enough empathy, of course. So just
So
saying.
we can go back to episode 1 where we talked about you should not have named your first clinic firsthand
Firsthand.
chiropractic or
Yeah.
firsthand health.
Yeah. Yeah. I've thought that many a time. So I've been looking up, because I'm not with patients every day, some of the things that on headache pain, I did not realize, and maybe you have because you're more in practice than I am, but magnesium oxide. And I don't know if the magnesiums are in standard process, but I did not realize that magnesium was that potent of a painkiller in even migraines, actually. We talk about coenzyme Q10. Of course, the curcumin helps. Curcumin helps systemically, so that's always a good one. Feverfew. Have you ever given your patients feverfew?
I have not.
Feverfew is similar to like salicylic acid,
Okay.
aspirin. And so feverfew is a good one as well. They talk about butterbur.
Yes,
And
yes. Butterbur.
I,
Yeah.
I actually have that. What else is that in?
Um,
I'll make you a bet.
I know it's an herb, but I have when you talk about salgesic acid, willow bark or the
Yes.
Medi-herb has, uh, is it salgesic is the
Is
name
the
of the
name of
product
it.
from
Yeah.
Medi-herb.
And
So
it has
willow
a
bark in it.
bark, but it might even have butterbur in it. I'm not sure. I know that I have something actually in my array of vitamins that I take. I think I have something with butterbur in it, and I can't remember which one. But that is great for headaches as well. So now I think though with migraines, all of those things, you also have to be careful of the certain foods. What are the foods that one, you have to be careful of low pressure systems. So when it rains, migraines get worse. Oh my God, chocolate is not good for migraines
Now,
patients.
let me ask you a quick question.
Yeah.
Milk chocolate or dark chocolate's not good. So are we looking at both of them being bad?
Yeah, I think so. I think it has to do with the bean. So yeah, you might want to avoid it if you are prone to migraines, either or.
And I believe if I
Check
remember
that.
from when I worked in your office, uh, nightshades.
Thank you. That's what I was thinking about. Totally. Okay. So potatoes, give me all of it. I am.
Potatoes, tomatoes,
Thank you.
strawberries,
Well,
and carrots.
strawberries,
Carrots
I
are
don't think,
also
what
anything that's
else?
kind of within the ground.
Yeah.
I believe peppers is another one.
Yes, yes, yes. Isn't that funny? I'm not in practice, so I don't have this at the top of my head. When I used to talk to patients, I'd be saying it all the time. But you're right, nightshades. And all of a sudden I'm forgetting all the onions, correct? No.
Yes, onions.
Okay. Um, anyways, people look up nightshades. As a matter of fact, Joe's going to be so kind that he's probably going to do something like underneath so that he tells you all the nightshades. This is even part of my webinar, but I haven't even done webinars in a while. So, anyways, yes, nightshades. But anyways, those are to avoid. But here's the other thing. Chiropractics even will still help migraines. I know that there is a different level of how the migraine works versus your average headache, but it'll still calm it down. The other is acupuncture. Again, on its own, it's not the end all and the be all. But boy, when you start doing one thing and the other, acupuncture really is sort of that finishing touch for a migraine. And I
So with
think,
acupuncture, we're trying to uh, open up those channels with an energy flowing through our body, because if there is a blockage in that channel, things start to build up and going in the wrong direction, or stagnation occurs. So we got to open that up so we can get better flow. Or in the world of acupuncture is chi.
and balance. I was just going to say balance, the yin and the yang, and the balance of, and it could be anywhere in the body. So it's not necessarily that you just do points in the head, but you make sure that you're on the correct meridian that will make that balance and sort of release some of the blockages with it. Migraines are usually, blood flow.
Okay, so migraines are usually blood flow, but then also hormonal too.
Hormonal can kick it off. Yeah,
Yes.
it's a
Um,
trigger.
Now let's go back to the acupuncture real quick, and just want to pick your brain. But a lot of times, if correct me if I'm wrong, those channels that get blocked, other than the circulation ones, uh, liver, large intestine, gallbladder, those particular meridians are really
Stomach too.
right. Stomach, when we're not digesting the foods properly and not getting the right balance within that area.
So some of the things I look at too, because it's a little bit different of a paradigm. Stomach meridian is a lot of it's on the head and face. Um, Large intestine is upper body. So any of these points usually are from navel all the way up. And then there's central vessel, which again controls the balance. Central vessel and governing vessel. Governing vessel behind central vessel this way. And so a lot of governing vessel as well. But whatever it is, the understanding is that it does release the blockages enough where we can get the migraines to go. But again, avoiding nightshades, and then stress. You and I talked about
Yep.
stress and anything.
Yep.
But headaches are probably the most physically associated with either daily stress or, when this is kind of interesting. I forgot that you had headaches when you were 5 years old. And so sometimes, because I do the counseling, sometimes, and I do a lot of I work with a lot of childhood trauma. So when you were 5 years old, sometimes I'll have to say, oh, it started at 5. What was going on in life? Forget about falling on your head, because that could be, but a lot of kids fall on their head and they don't have, Yeah, they don't stop. They don't have headaches like the rest of their life. So question, what would, and then we won't get into your big personal history, but this is kind of what I do. What was happening in life at 5 years old? And even if one doesn't remember because they're so young, because I'll ask it what was happening at 1 and 2, and of course they don't remember. So you have to rely a little bit on stories. So, what was happening in your life at 5 years old?
Well, to be authentic and upfront with everybody, my dad passed away when I was 5 years old, and in a construction accident. At that time, my mom and dad were divorced, but still, the loss of that figure in my life, um, having to become the man of the house, which is a very, how do I say, difficult thing to carry at that young age. And I don't
Huge
think it's
pressure,
fair
huge
to say
burden.
that to most children at that point in time, but it's, it's just the way it was and the way it is. But um, yeah, that's what happened during that time in my life.
And so, even that information, and I don't think I ever knew that. So, I'm so sorry to hear, like, I don't even know how your father passed and all that. I had no idea. I don't think I knew, but I do forget a lot of things. Um, that's the type of information that when you get from that unconscious, like, oh, that did connect. And oh, the man of the house at 5 years old, what a burden that
Mhm.
must be on a child's mind and head. Of course, you had headaches.
Yep.
And so we do want to look at stuff like that as well.
So what you're speaking of too is what we call neuro emotional technique, where we dive in a little bit deeper of what are those hidden emotional factors that lock on to our nervous system, and what do we need to do to unlock those things and allow that person to become more aware of it, and how when the chiropractic adjustment and the nutrition is administered or suggested, everybody works together holistically. If I
Let me,
could, if I could, I think one thing that we're missing from this is for our viewers and our listeners, the audience, to understand that when you have a headache, it is not necessarily your brain that is experiencing the pain. Typically a headache is a overdilation of blood vessels around your brain in the head and tension in the neck because of that cervical genic, that word that Dr. Russo had said, that tension that builds up and it just overwhelms coming up over your head, around your eyes, sinus issues, inflammation. So we've talked about inflammation before. So headaches can be multifaceted as we have talked about. So it's a matter of understanding its pain and we want to take care of it. And how do we take care of it in the most right way? Um, and we have so many different tools. The adjustment is key. The nutrition is key. It's digging the root out of those emotional issues that we have suppressed over time.
and I want to add to, like, when you looked at NET, which was Scott Walker's work, um, part of that isn't just to raise it from conscious to unconscious. There's unconscious to conscious. There's a purpose for that because the body actually now sort of can release it with that information when it gets from the unconscious to the conscious. We go, oh, there's that thought process enough where we go where we can release it. And whether it's a resonance or a frequency or something like that, but it is part of the healing. You don't just bring it up just for the sake of bringing it up, because with NET, by the way, we work with acupuncture points, and we'll do a certain tapping technique as you're going through it, and so it clears it even on an acupunctural basis.
That's right.
So that's the other part of it. That's the other kind of acupuncture part, we could say, with that.
So, Dr. Dash
Yes.
Live Well.
Yes.
Let's go to question number 2.
And that would be,
how do I determine
Mm.
if I should take an ibuprofen or a pain medicine or an aspirin to help affect that pain that I deal with?
Well, everybody, I'm sure they asked you that question, and I'll let you. I mean, for that question to be answered from our point of view
Exactly.
is difficult.
It is
One,
very
because
difficult.
we can't say don't do that because it's so supposedly not in our scope of medicine to say don't do that. So,
Well,
because
let me say what I normally say is I do not have a license to recommend you take something or not to take something that you're already taking. That is between you and your family physician. But I can advise you on the side effects. I can encourage you to take something more natural and holistic. And we have the chiropractic adjustment. We have all these other techniques that we utilize, the physical therapeutic modalities to help ease you, your ability to deal with this pain so that you may not have to take these things. But that is something to between you and your doctor.
yeah, you're so professional.
Hey, it's called CYA.
I'm not really good at that. So I could just say things like, "Well, you can go now." Mind you, if I'm really, really inflamed and I haven't been, and I just get tired of like a certain amount of pain, I am an Aleve kind of gal over some of the other ones, which is naproxen, but I I usually say I'm always going to recommend doing things like curcumin or do your omega 3s or all of the herbal ways. Again, magnesium is a great idea. All of these things to sort of calm down the inflammation or this even the systemic inflammation. But you can always take an ibuprofen. Just make sure that if you take it a lot, that make sure you're going to have to take more meds for your ulcers that might show up, even bleeding ulcers, or you could get heart attacks eventually from it, MIs, myocardial infarctions, or I don't know, if you take it enough, you can, and you have kidney problems, you can get more chronic kidney problems, but go ahead, take your drugs. So that was your way. And now it's my way.
So what I'm hearing you say is pay me now or pay me later. Do this now or you're going to have problems down the road. And it's just when you said go ahead, I just got a thought in my head one time when we were walking into a grocery store with
Oh my
my,
gosh, don't you dare.
but that's for another show. But it's
Like a totally different kind of show.
totally different discussion. But
So wait a minute, are you talking about my open mouth insert foot
oh, okay.
capability?
Is that hand, foot, mouth disease? Uh,
Yeah.
so anyhow, back on track. Um, but it truly, we give them the options. People, it'd be great if we're all robots and everybody did things the same way. But the sovereignty of God is He gave us all free will to choose. So there's consequences for our choices. If we choose to do things in a more holistic approach, we may add life to our years and years to our life. But if we are stuck to the branding and the indoctrination of our society and do nothing but chemicals all the time, then it's kind of like garbage in, garbage out. You reap what you sow, or you are what you eat. So we have to be very careful about what we're choosing to do because there's going to be consequences no matter what, whether it's good or bad.
So acetaminophen, right? Did I say
Yeah.
that correctly?
Yep.
Um, you can get a toxic liver, hepatotoxicity, if you want that.
Yeah. Or uh, what's that? Taking an aspirin a day for your life. They're saying, kidney disease, heart disease, liver disease, and yet they're saying it's okay to take this stuff to prevent these things from happening. And it's almost like you're damned if you do, damned if you don't.
Well, here's the deal. What we're saying is just don't listen to them. But
Do
go to your
research.
family doctor.
Do research.
Yes, that's a good way.
Ask questions.
Yeah.
Don't just take our word for it. Make an informed decision. Pray for wisdom. What should I do?
Well, that's a great one. Is literally hearing him speak to us, really, really focusing on him speaking to us. And I think, that is where our ultimate answer is hearing his voice.
Yeah.
I love what Jim Baker said. He said, okay, everybody, close your eyes and say your name, like to yourself. Phyllis Russo, to myself. You don't say it, you just hear it. And then he goes, that's what God sounds like when he's talking to you.
Mm.
It's your voice. Every once in a while, people will say, no, I heard a distinctly different voice. But most of the time, it's our voices. And so that is a great way. I always love that we add that into our talks because sometimes you don't know, and sometimes we're wrong. Not as often as the Western medicine doctor, but yeah, you want to hear his voice and do the research. I think that's the best thing to tell
So
people.
let me add briefly about what you just said there. The word says life and death in the power of the tongue. And the word is a lamp unto our feet and a light unto our path. So the words that we speak to ourselves is very, very important. And we have authority over our bodies. So what we speak out comes back to us. So when you say your name, that's very important. And how you believe about yourself is even more important. Shall we dive into question number 3?
I can't remember what it was, but go
All
ahead.
right. How or what did I do to
Oh,
cause this pain?
okay, you start that one. Roll on it, buddy.
So there's moments in time when I'm getting ready to adjust a practice member or soon after coming off the table, and they'll look at me and it's like, what did I do to cause this or create this problem? And I'll look at them and say, sometimes it's not just one event. Yes, if you were in a traumatic motor vehicle accident and say you rolled your vehicle or you totaled the car or you had a bicycle accident like me. I had a bicycle accident at one point in time, went over the handlebars after I went over railroad tracks and fresh asphalt and laying there on the ground. And my buddy says, get up, here comes a car. I say, I'm just trying to make sure everything's still attached. Continued the 14-mile bike ride, but still I got adjusted. So I knew there was trauma, but there's a lot of times that trauma is small, little events on a continual basis. And there is not one thing that sets it off, but then that one moment we take we say, maybe we cough, maybe we turn wrong in the bed, maybe we lift a small thing off the floor, and
Maybe
all of a
we brush
sudden,
our teeth.
bam, yeah.
Some
Oh my
people,
gosh, you have that so correct. I've had numerous practice members bending over the bathroom vanity, brushing their teeth, and all of a sudden they can't stand up straight.
yeah, that's a big one. Isn't that crazy? But it's a big one.
That's it. That's the last time we're going to brush our teeth.
No, we talked about that earlier. Don't do it. It's
So,
okay. We'll fix you.
to pinpoint the cause is sometimes you have to sit down and you have to reflect. Uh, what have I been doing? Am I on my phone all the time and I'm in that flexed forward position, and then finally I go to get up and I can't straighten up all the way. My shoulders are rounded. All of a sudden I have one down like this, and then my hip is hiked up. I mean, look at me. I'm twisted. And so all of a sudden I want to take a deep breath to talk to you more, and I can't. But if I sit up the most right way, my head's in the right posture, I'm looking forward, I take a much deeper breath. So our posture, poor posture over a long period of time equals poor health. So we really have to take in reflection of what are we doing to ourselves on a daily basis. And so again, it comes back to the consequences of our choices and the routine that we have put ourselves in. We've gotten into a rut, which is part of routine.
Um, some of the things, let's say if somebody already has autoimmune, and they already have this inflammation, their diet is so important. And yes, some of it is restrictive, but you don't want to do any type of glutens or grains. But wonderful regenerative meats that you can eat, maybe a little bit more of a Mediterranean diet that has more vegetables in it. Again, I always say omega threes, but you don't have to take omega threes every day. Good oils when you're cooking, avocado oil. You don't want any trans fats in your diet. So I got to admit, I always look at that nutritional. I'm trying to think, you know, lately I have to eat more singular foods, just to keep my gut kind of in order. But those are other like wonderful things you can do. You can do curcumin on a daily basis. You certainly can do magnesium. You could do CoQ10 on a daily basis. With herbs, though, I say like curcumin. Let's just take curcumin, and you're a headache person. I would play with it, and I know I don't know why, but I totally went off topic or what you were saying, but who knows what comes into my head. Yeah, I know I do that. But everybody knows I do it. I think all of your patients now know that that I do squirrel. Now I forgot where I was saying.
Curcumin.
Oh yeah. Any herb, I say, I'll take a little bit of a break of, like take it for a month. If you want to do it consistently because you have chronic headaches or something chronic, take a couple weeks off. You might be hurting just a little bit, but you don't want to keep building. It's almost like taking a drug, so you don't want to build too much of it up. But definitely you can do magnesium all the time. Make sure, I just had a conversation. I almost want to say an argument, but a conversation with a gentleman who deals with a lot of copper and feels that copper is sort of this panacea. And in some regards, he's right. I know I do. I was going to also talk about peptides when it comes to all of this pain. But the company that I've worked with, Pushpatch, they've actually added a ionic copper and the copper type of peptides, because copper and magnesium actually help. The copper helps magnesium work where it doesn't deplete certain things, doesn't cause some other side effects if you overdo on magnesium. So copper is actually kind of a big part of what we want as anti-inflammatory nutrients and anti-inflammatory herbs. So we want to keep that in mind as well. So I just wanted to say that about some of the herbs is that you take for a period of time, and then you take off maybe a week or two, and you take for a period of time. And again, this is more chronic. But everything, that's the whole thing about our health. Everything adds up. Chiropractics, acupuncture. I had a bad day, and I think we've already talked about some of my problems that I had a couple months ago in my gut. A couple of the most important things for me. I am what is known as a nosher or a snacker. And I will eat, I don't eat a lot at one time, but I'll eat snacks continually throughout the day, which means I'm not giving any break to my motility, any break to my digestive. And I started eating once every 4 hours, breakfast, lunch, and dinner. And it has made a world of difference, to the point where on Sunday, the Boy Scouts gave me a popcorn bag for $20. That's all I paid, was $20 for a popcorn bag. And what did I do? I ate the whole thing throughout the day. I was so bad the next day. So I did not No, I think it was bad that day. It just destroyed my gut. So I brought that up for a reason. Why did I bring it up?
The consequences of your choices?
Yes. And also, I think really just follow, that it takes everything. Oh,
Yeah.
I know what I was going to say, but it takes everything. It takes how you eat, it takes what you eat. But one of the things I was going to say is I went to a place called Perspire, and I don't know if you guys have them over there, but it's a infrared sauna.
Okay.
Do you know that was the kicker that I finally felt better. And so these are all these things, these peptides, all these things we can put together that we really don't have to take medications with such serious side effects. And again, you might not get them the day after tomorrow. But if you just keep taking these drugs, over and over and over again, every day or every week or whatever, eventually they're going to bite you in the butt.
Yep. Yep. I agree. So tying that together there, depending on the cause of your pain and the symptoms that you're dealing with, as providers, we recommend lifestyle changes.
Yes.
That is eating a healthier diet, as we continually talk about, little snippets here and there, uh, gnashing, grazing, uh, choosing the right foods, making some changes. If nothing changes, then nothing changes. And you
Exactly.
do the same thing over and over again, hey, it's insanity. How about exercise, movement?
Mm.
I know we've talked about too much movement could be a bad thing, but really getting out there and moving. I mean, I mentioned about twisting an ankle. What's the best thing for that? Sometimes is continually moving. If it's not damaged, you know, we have pain receptors called nociceptors that are being exhibited when you have pain. But when we start to move that joint, mechanoreceptors within that joint start to override that pain
Yes.
and reduce that swelling, that inflammation. So that's why I want people to move. That's why the adjustments that we perform as chiropractors is so important to restore function to those joints, not just in the spine, but the SI joint, the sacroiliac joint, the knees, the elbows, the shoulders. You got it. We can move it. How about losing weight, removing that inflammation in the body because we've made some poor choices over a period of time and we're dealing with stress? Oh, wow. The next one, managing stress. And all of it sometimes happens because we've got some mental health issues and we don't know how to deal with them. So, being able to be in a safe environment to talk it out, to release that, i.e., we were talking about neuroemotional technique, to be able to talk and let it out. Otherwise, we continue to stuff it in, and then what's going to happen? Something's going to explode.
Well, that's, you know what, that's a lot of the work that I do. And that is, I mean, my background is mental health coaching. And so I've been working, as I've been working with the autoimmune and the Hashimoto's patients, I've realized that if that doesn't get cleared out, even nutritionally, we're having a hard time going someplace with it. And so I do sessions with my clients, and I do drumming with it because the resonance of the drum sort of puts us, because sometimes you want to be in a meditative state, and obviously in a very safe environment, but a meditative state, and the drum is just this beautiful. I'm going to interject something. Do you remember, were you at Family Church still when they did a Christmas program where it was the drums?
I don't believe I was there then.
I think you had just left. I think it was even that year that you had left. They did where the drums, the boom, 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 the beat of the drums, they came in from the back of and you know how big that place was. And there was something like 20 or 20, it was almost like a drum line. It was like that many, 20, 25 drummers. And my brother was a drummer. And so I've always responded to that rhythm of the drum. But and so that's incorporated in what I do. I know it sounds funny, but we'll go through the therapy portion and the getting it out, and then the meditation portion of really sinking in and letting God clear it out, not just bringing it from the conscious to the unconscious, but also seeing where God can heal it. And we go into that meditation when we do it. And it's such a profound change, such a profound change, like almost right before their eyes. So, and I never ever go, okay, you're done. I go, okay, now that you feel really great, make sure you eat well. Make sure you stay off the gluten and the glyphosates. Make sure that, and here's the thing. When we go through that, though, they do handle stress better. Like they handle that outside, who they're fighting with at work, or, what goes on there, if there's some relationship issues, if they have the kids are running around, it's almost like they have a calm where they can handle it, where they can look to God, where they can hear him better. And that's kind of the beauty of adding that to chiropractics, to detoxification, to using things, again, if we're looking at pain, even topicals. I'll talk to them about, I have somebody coming in today who were still finishing up some sessions. And she says, but can you also like adjust my back? So, and it's a part of it. And everything we do, we add capsicum to a local area of inflammation or pain, add arnica gel. Arnica gel is amazing. When it comes to that, it's magical in and of itself. So when you have local pain, and that's another one is knee pain, BPC 157, the peptide, and you've got to make sure the government doesn't stop things like that. There was a whole conversation, we could have that one day, on GLP-1s and the others that, that's a whole other conversation. But anyway, just making sure the government doesn't get into these peptides. Because here's the thing, these peptides work like you cannot believe. You cannot believe how well they work. And the government wants it out, and Big Pharma wants them out. So it's compound pharmacies that do that. So just I just want people to be aware, because peptides are it is what one might say like the new medicine, and they are quite amazing, and they come from natural substances in our body. And sometimes there's plant peptides. So they're all really quite natural, and they're even produced and compounded natural. But if Big Pharma gets a hold of it in their way, it's not going to be, and you're going to see all the side effects coming from it. So
everybody wants eventually to get a piece of the pie, basically.
Yes.
And the unfortunate thing
greed.
Greed. Yeah. As the landing gear is down, what I want people to really understand, as we've touched on 3 questions, is that, and this is the one thing that I find in my conversations with patients, practice members, people in this world, they get stuck on one thing and think that's it. That's going to cure me. Whether it's chiropractic, whether it's acupuncture, whether it's medicine, whether it's a copper fit brace, or you name it, they'll get stuck on one thing. And what we want everybody to understand is it's a multifaceted approach a lot of times when we're dealing with managing the pain that we're experiencing and expressing. So it's what has occurred to create that pain may not be one particular event, and sometimes it's not one particular modality, I guess is the best way to put it, or ingredient in the recipe to get you whole, get you well. You need to be willing to be open and ask questions, but also listen. Listen to the education that we have for you, because I feel I'm kind of biased. I've known Dr. Russo for a very long time, and I've known myself a long time. What we get to do is to speak into your heart. And I feel that what we're talking about is authentic. Uh, we're not trying to just sell you on something. We want you to make those best informed decisions to help change your life, and so that you can experience things more abundantly, naturally.
Hey, you did that very well. Um, I was going to say one other thing. Oh, that knowing both of us, our hearts were designated, I think, from the very beginning to be in service. And that's my joy of living. And I know it is yours as well.
Yes.
So abundantly, naturally.
Yes. Well, I want to thank everybody for tuning in. It's been wonderful. It always goes fast. We always have a lot of information. And yes, it may seem like it's a long show. Try to digest it. And if you have any questions, reach out to us. Comments. We will respond to them. So look forward to connecting with you again, everybody. And also Dr. Russo, Dr. Dash Live Well.
Thank you, dear.